Hello, I'm Dr. Fred Venditti. I'm the Hospital System General Director here at Albany Medical Center. I'm joined today by guest host Kate Keefe, who's an AVP in nursing, responsible for our post-surgical services. Let's go to the numbers and talk about COVID. So on the screen you can see the graphic that we've continued to show about the number of cases in the capital region, and you can see it remains flat. We're still in the high 30s in terms of hospitalized patients with COVID. The next graphic is again something familiar to you, which shows the admissions and discharges, and you can see over the last several days there have been a few admissions and a few discharges equaling the same number. So then on the third graphic you can see that our inpatient census for COVID patients remains flat at 8. Of those 8 patients, 6 of them are on the floor, 2 are in the intensive care unit, and 2 of them are intubated. And again, as I mentioned on Tuesday, that is new. We had not had any intubated patients since late June. So that's it for COVID today. The numbers that are out in the community in terms of positive cases still remain relatively low as well. So as I said, Kate is the AVP for post-surgical services. One of the areas that you're responsible for is the transplant unit.
Yes, I am.
And we have some good news about the transplant program here at the Medical Center. Would you like to share that with us, Kate?
I certainly can, but I can first start off by saying that we are in our 50th year. And we have had how many transplants so far?
2,700 transplants since 1969. Yeah. Isn't that tremendous?
It's phenomenal. It's absolutely phenomenal. Yes. And being able to listen to the stories of the patients afterwards that are so blessed by having this done, it's really heartwarming. It really is. Go ahead.
Go ahead.
No, I was going to say also one of the benefits that we have here is that the unit that the patients recover on, the staff is absolutely phenomenal. Maricard does a great job at managing the unit. The staff are great, extraordinarily experienced. They work in conjunction with the physicians, the practitioners, and throughout the house. We're very lucky.
They really know their stuff. It's a specialized unit, and it's a group of nurses with special expertise in the management of patients who've undergone transplantation. So that's really, I think, one of the very important elements of our success.
Absolutely.
The outpatient clinic also is very specialized and has a host of specialized physicians from other disciplines besides surgery, helping to manage those patients, and again, nurses who are trained in the care of post-transplant patients.
Absolutely.
So while we're talking about nurses, you've heard me talk about the 100 and 100, recruit 100 nurses in 100 days, and Kate, along with several other members of nursing leadership and HR, has been leading that charge.
Yes.
So Kate, we have a video we'd like to show, right?
Yes, I think we should go ahead and show the video, and then we can dive into some numbers of our progress so far to date.
Great.
When I was younger, and my children were younger, I had a stroke, and I was at Albany Med when I had the stroke, and I was in the neuro ICU for about 6 months, and I watched the nurses there, and they cared for me, and they were tremendous, and they were so knowledgeable, and were so able and capable. I thought I would love to do what they're doing, and I'd love to do it here. I thought when the time came, I would want to return, and I did. Here I am.
Albany Medical Center has a deep, very positive meaning in my heart.
It's one of the best places to really expand and find who you are as a nurse. I came to Albany Med 23 years ago as a brand new nurse, and my first job was on the ortho spine unit, and I absolutely loved it.
I wanted more opportunity. I was trying to pursue my RN, so I came here just wanted to expand my skills, and I very much have done so.
I've always thought of the opportunity of working for Albany Med. I've always wanted to. I love it, and I definitely know I'm home. This is where I want to be. Nursing is a career that you can redevelop and you can reinvent so many different ways. There's bedside nursing, there's clinic nursing, there's educational nursing, there's research nursing. It's forever developing. People are always going to need someone to take care of the ill. It's a role that can never ever be replaced.
And there's so many opportunities for growth. It's just a really wonderful team to work with.
Don't be scared of a challenge coming to AMC. You'll be able to expand beyond that of a nursing home or other facilities. You get to really learn here, and they're all about teaching and all about advancing your career.
My name is Allison, and I'm LPN at Albany Medical Center.
My name is Liz, and I'm a registered nurse at Albany Medical Center.
My name is Anthony, and I'm an LPN at Albany Medical Center.
All right, that was an absolutely wonderful video. I thank you so much for the communications team, marketing, for putting that together for us. We had some exceptional nurses who did that for us, and they're truly phenomenal, and we're very lucky to have them.
It really, really is a great video. So Kate, you've had a lot of success, you and the team.
Yes, we have.
I think as of today we've hired 90 new nurses.
Yes, at 12:30 this afternoon, I heard that we had 90 acceptances so far, which is phenomenal. Out of the 100 we were originally supposed to meet, and now which has been up to 150.
The goal is 150 now,
Yep,
that's
150.
right. So give us a little bit more detail about those 90.
Sure. So I will tell you that out of those 90, so we started this back July 10th of this year, so about 6 weeks ago. We're finishing up the end of the 6th week right now. We had another section of interviews yesterday afternoon that went well. What we're seeing is when they are interviewing with the managers, some of them are being offered on the spot because they're meeting all of the requirements and the needs, including a perfect fit for the unit with those managers, which is nice.
That's great, and a number of them are experienced nurses. We're not hiring just new grads, right?
Correct.
So that's an important aspect of this.
Yes, I would say probably it's been almost 50-50.
That's great.
In the beginning it was probably more experienced nurses, and now we're seeing a lot more new graduates coming in. But a lot of these new graduates that are coming in have had experience in the past in the medical field, either as a PCA, an LPN, an MHA, some kind of experience. So they're not coming into us just completely
They have some clinical
They do.
skills.
Yes, they
yeah,
do.
That's tremendous. So we're going to get to 150?
That's the plan. I think we
That's
can do
great.
it. I think with the team, Emily Wright and I are the nursing pieces of the puzzle, so to speak, working with recruitment, working with HR to go through all of the applications that we've been receiving and try to find people the perfect fit for their perfect home.
Well, I want to thank you. I want to thank Emily, Sandy Castillo, Leslie Dool, and everyone who's been working on this. The results have been tremendous. And while we're talking about thanking people in the organization, I want to say a little bit about the employee picnic. Obviously, this year is going to have to be a little bit different with COVID. The social distancing that's going to need to take place is really going to cause us to change how we go about doing this. But we do want to express gratitude, as we do every year, to our employees. So this year there's going to be a gift that will be given out to all employees, and we're going to do the Brooks Barbecue again. We're going to do it a little bit differently. Each employee is going to be given a ticket, and we're going to spread out the barbecue handout over 3 days so that we can maintain that social distancing. But we want to thank our employees. This has been quite the year with COVID. They've done a tremendous job, and this is just a small token of our appreciation. So with that, that's it here from Albany Med today. I want to again thank everyone for their hard work. Take care of yourself and take care of each other.